Hey folks, my name is Mo Amir and this is VANCOLOUR, British Columbia's bona fide culture and politics TV talk show. Tonight, JJ McCullough is here to discuss how Canada's tariff fight with the United States may have helped the popularity of BC Premier David Eby. Plus, we'll talk about government waste from a level of government that until recently, most people, including myself, didn't even know existed. But first, I don't have to tell you about BC's healthcare crisis. We have long emergency room wait times and outright closures. Maybe you don't have a family doctor, or maybe you are one of the estimated 1.2 million British Columbians on a wait list to see a medical specialist, a wait list that continues to get longer and longer. But how are these wait lists affecting your health? Here to explain is a neurologist and clinical associate professor, the president of the Consultant Specialists of BC, Dr. Robert Carruthers. Doctor, thanks so much for being here. I appreciate your time. Let's just start at the beginning here. What is a medical specialist? How is it different than a doctor, I guess?
That's a good question. You know, every human being does need a family doctor, and they look after you for your entire life, right? Ideally. But, you know, everyone has, like, probably at some point in their life, something comes up, right? Maybe it's bad migraine headaches. Maybe it's a need to get a hip replaced. And so that's when you see a specialist. So, and you know, I'm a specialist and, you know, I have hands, but I'm not a neurosurgeon.
Okay.
Right? I have eyes, which qualifies me to see an ophthalmologist, but does not make me a radiologist or a pathologist. But if you give me, you know, some time with a patient and you give me my tools like a reflex hammer, I can figure out what's going on with a person in the brain, spinal cord, their nerves, their muscles, or what have you. And, you know, we do help people with like niche disorders, rare things, and even just common things, right? So like we know mental health disorders are very, very common. 1% of folks get Parkinson's disease. You know, we're here for British Columbians, and British Columbians depend upon timely access to specialist care.
So really, when we talk about major illnesses, you know, cancers, you have to see a specialist in order to have a treatment plan.
And like greater than 90% of people who end up getting cancer care have been seen and are referred by a specialist to the BCCA.
Oh, interesting.
So if you're in that journey and there is a delay of even more than a month, that actually impacts your mortality rate. They're higher with longer delays.
So let's talk about these delays, though. When we talk about these wait times, obviously there's so many different types of specialists, but can you give me some examples of how long it takes to see some of these specialists?
Right. So for neurosurgery, for non-urgent issues, it's 16 months.
Oh my God.
There are neurologists for non-urgent issues where it's, you know, greater than a year, maybe 2, and in some cases like 3 years to see a neurologist. Orthopedic surgeries are surgeons are having very long wait lists, maybe like 500 people on their wait lists. Urologic surgeons, so if a person has a prostate issue, they are going to be in a wait list of like 300 to 500 people as well. And dermatologists have 1,000 people on their wait lists.
If you have a wait list of 500 people, what does that mean in terms of your family doctor referring you to a specialist? How long of a time period is that?
Oh, it's going to be long, right? Because there's always rush stuff that comes up. There's somewhat less urgent stuff. And so you're always triaging from your patients. And there's just stuff that doctors are telling us that they're not going to get to, right? And that's kind of a chilling idea that you might be stuck on a wait list and maybe even worsen. I have an example.
Sure.
So a patient who I ended up meeting at Vancouver General Hospital, he was living up north, and he was experiencing over like 18 months, slowly worsening balance, and then worsening gait problems. And then it really accelerated and culminated in him being hospitalized, transferred to Vancouver General Hospital, where an MRI showed that he just had really aggressive MS.
Okay.
And it was so bad that he needed to have chemotherapy. He didn't bounce back with the usual treatments. And so ultimately he had quite a good improvement. He went from being barely able to walk, and now he can walk reasonably well, but he definitely lost ground and has lifelong disability as a result. The impact on the system is also really difficult in that there was a long hospitalization. He needed to have chemotherapy, you know, like, so this took up a lot of more resources than it needed to. And if he could have seen a neurologist up north quickly, then it would have, you know, maybe prevented him from having all this disability.
So big picture, what I'm hearing is things that can be nipped in the bud or addressed very early, because of these wait times, they just aggravate whatever the health condition is. So it gets a lot worse.
That's true. So it's worse for patients. There's a delayed diagnosis and there's increased cost for the system and more waiting for other people, the worse this gets. And We've been trying to get solutions to improve things for British Columbians. And 2 years ago, a similar study showed that things weren't great, and now it seems that they're worse. And there have been some negotiated solutions with the Ministry of Health to try and push things along to make some efficiencies within the referral system. And so we're waiting for a meeting with the minister. And we do have a meeting with their chief of staff later on this week.
I think when we think of solutions, we can talk about structural things like increasing capacity, but is there anything that can be done immediately to help alleviate some of these wait times and help patients?
That's true. So that's a big priority for us. One is that we want doctors to be spending a bit more time focused on their wait lists and, picking up on people who might need to be seen a bit sooner. We also want to see new efficiencies in the system where, say, maybe a doctor sends a letter saying, hey, I want you to see this person. And you read the letter and you say, you know what, like the answer is this. I don't need to see this person. You send back a quick note saying like, hey, like this is what I need you to do. And then send the person back to me if it doesn't work out. You send it back to the doctor and there you just created a space for another person to be seen. So we're hoping that the Ministry of Health can help us starting that type of thing. We've negotiated a wait list management system where we do that type of thing. Doctors spend more time on their wait lists, and then with time we get data with MSP and the Ministry of Health that shows them throughout the province and in each specialty, where are the wait times.
Right.
Now, the neat thing we could do with that information, it might take a little while for us to accrue enough useful information, but what we could do is say, okay, let's make a targeted investment so that we can improve access to a certain type of doctor or to a certain region, or even improve regional, such as Northern and North Island and Interior access to specialist care. Right. So maybe it means that we have to improve these outreach programs for specialists. Or incentivize folks to live closer to those communities. But we really don't even have like great data for the whole province across all specialties. And in fact, the survey we just did is the best data that we have, and it doesn't look good.
So even just getting oversight of understanding who needs these specialists.
Yeah. So it would be great for the Ministry of Health to have a line of sight on that. Because it is true that we just don't have enough doctors. We don't have enough family doctors. There's people who don't have them. And it's the same deal. We do not have enough specialists. And it's anticipated that this is going to get worse.
This sounds terrible. 10 seconds or less. Are you at least optimistic that maybe things will get moving in the right direction?
I think once we have a better line of sight on where the wait times are, we can do more to invest in solutions that will help British Columbians get timely access to specialist care. I am concerned about how things are going, right? And I think we have seen that the longitudinal family practice model has increased the number of family doctors sticking around. And I think we're going to have to make similar investments to enhance access to specialist care.
Doctor, I appreciate your voice and I appreciate you bringing this to everyone's attention. Thank you so much.
Thanks for having me. Appreciate it.
Folks, that was the president of Consultant Specialists of BC, Dr. Robert Carruthers. Now, after some business, have you heard of Metro Vancouver? Well, it's been making news lately for all the wrong reasons. We'll explain up next.